I'm Ellen Leahy, the health officer for the Missoula County Health Department, and this is Monday, August 17th, COVID update for Missoula County. Missoula County currently has 80 active cases. We have 333 close contacts in quarantine and being monitored and offered testing. 3 people in local hospitals, 2 of whom are Missoula County residents. In terms of the sources of the current active 80 cases that we have, our largest source is actually close contact to a case. And that's actually a good sign because that indicates that, and that's 46% of our cases right now were derived as close contacts to a previous case. So that indicates that people who did become infected were able to identify who they had been in contact with 2 days prior to their infection and onset of symptoms. That's when they become contagious, and thereafter, so that we could very quickly identify those folks, check them for symptoms, talk to them about going into quarantine, and offer them testing. And so that is one of our major control strategies for this pandemic, and to have most of our cases currently have been discovered that way is a good sign. We do still, though, have our next largest group of cases arising out of community spread where we're unable to know where that infection was caught. We still have a third of our active cases arising out of the age group 20 to 29, and as we've discussed before, that is an age group where often the symptoms are very mild or absent, and it's very difficult for folks at that age to know that they're infected and contagious. So as we've talked, as our university is now opening, that is being taken into account in all the messaging and all of the safety factors that have been put in place. And I think a good rule of thumb, besides keeping your number of contacts in your life, particularly in your private and social life, low, because your school will be keeping them as low as possible in that structured setting, is to consider that you or anyone that you're with could be contagious, that's the basic rule of thumb. And then keep your distancing, wear your masks, and keep the numbers of contacts small. One thing, we've talked about the R rate or the transmission rate in Missoula County. Even though we're getting new cases, other cases are resolving, and our R rate, our transmission rate, is holding in a bit of a plateau. But of course, that's 2 weeks out of date. So we will get new numbers again tomorrow, Tuesday, and I'm sure that when Cindy's back, she'll talk with you about updated figures. But I wanted to introduce a new epidemiological statistic that we keep an eye on. And unfortunately, we have enough cases in the state now that we have the kind of data that can be representative, and it will tell us some things. It has some limitations. But I want to talk about the number of active cases per population in the county. So certainly, if Missoula County has 80 cases, that's 80 cases, and that matters for the control strategies. It matters for those people. It matters if they need medical care or hospital care. That number 80 matters in any county. But it's a different level of incidence in Missoula County, a lower level of incidence compared to population than that same 80 cases might be in a very small frontier-sized county with a few thousand people population. And so now that we have that statistic more available and it's more useful, I want to start introducing you to it. So for example, Missoula County's incidence per 100,000 people population, so Missoula County I think has about 117,000 people population, and then you look at your active rate, and this has not been recalculated for today, so this is Friday, and I'm sorry, but to give you an example, and then if we look at it over a 14-day average, okay, so the reason we're looking at it a 14-day average is if you look a day at a time, depending on people get tested, you're going to see kind of a sawtooth. One day you're going up, one day you're going down, you're going up, you're going down, and it's like, where are we? So we use the number of active cases per 100,000 population, that's the denominator, and a 14-day average of only those active cases of a look back. So Missoula is running an average of 36 per 100,000 people in our population on the average over the last 14 days. By comparison, for example, Yellowstone County, using that same measure, a 14-day average, number of active cases per 100,000 population is at 279. Then it becomes really important when you start looking at, for example, a small county that has a lot of cases, but it might have a lot fewer cases than we might have in Missoula County or in another large county such as Yellowstone. So Bighorn, I'm sure you've heard, has been very hard hit. And when you look at their small population and the number of active cases on average that they've had for the past 14 days, their rate per 100,000 population is actually 1,129. So look at the difference that you can see when you look at that actual that particular statistic instead of just the raw number of cases. So again, Missoula, using that statistic, is 36. And then if we want to look at the counties surrounding us, or at least to the north and south, that are more moderately populated, Ravalli County, that statistic is 24, and Lake County, it's 38. And of course, since we draw workforce and students, and particularly our healthcare workforce, into Missoula County from surrounding counties, we really appreciate it when folks from surrounding counties cooperate with the requirements and the recommendations we have in Missoula County, because there are so many people here. We are trying to get schools started. The university is located here, and our healthcare hub is located in Missoula County for those surrounding counties as well. So again, that current figure for Missoula, 14-day average number of active cases per 100,000 population is 36. Thank you.